get that. All right, recording in progress. So I'll go ahead and ask you guys to mute then. I'm just going to mute you, Ashley, because you're bumping around, just so that I already did it for you. Just so that y'all can hear me just fine. And then I'm gonna give some time for questions at the end, but if you guys have any questions throughout, just unmute yourself and ask. It's a nice small group, so please don't feel like you're interrupting. I really want you to get as much as you can out of this. So if you have any specifics you want to ask at all at any time, go for it. So, welcome to my first live webinar. So I'm really excited you guys joined. And I'm excited about bringing this focus online because just like you guys are doing, I know it's so hard to show up in person at this stage in postpartum. So I remember that being hard for myself, and it's just another barrier, right? It's so hard. Even when I was running these similar pelvic floor and core workshops in person, I opened them up to prenatal and postnatal, and I would usually have the prenatal moms come who didn't already have babies because it's just so hard once you have the kids to juggle that extra thing. So I wanted to bring this online for you guys so that you can, exactly like you're doing, feed babies or bounce babies or do whatever you need to while you're listening. Again, we'll have it as a recording as well. And part of wanting to create this webinar is to tell you guys about my 6-week online postpartum course, which again, I created exactly for you guys in mind, for those moms who are time sensitive, which is all moms, so that you can start to build a movement routine into your life again and not feel like, oh my gosh, I have to take 2 hours out and get a babysitter and get to this class, et cetera, et cetera. So that's really the intention, is trying to make it more manageable because I know time is so tight. So before I jump into that, I want to start talking about my own experience with back pain postpartum. So just a little, I know Ashley's the only one with video on still, but just a little raise of hand. Who is experiencing back pain postpartum right now? Are you, Ashley, or are you just wanting to learn more about healing postpartum?
Yeah, just pelvic floor things
Pelvic floor
mainly.
things, 100%. We'll
Yeah.
definitely cover that. And how about Lauren and Maria? Are you guys experiencing, oh, I see Lauren raised her hand. Yes, experiencing back pain. And then Maria, I don't know if you can yeah, I see hand raise as well. Okay. So, and it's all connected. So that's the thing that we're going to go over a lot today to make sure. Okay. So my own experience with, I want to tell you about it with postpartum back pain because it really illustrates two different ways to heal postpartum and really the results of that. So, when I had my son in 2017, I was already teaching yoga and hula hoop and movement full time. I had been for a couple of years. And just to kind of set the stage, I already had a lot of body awareness. Like I was very uncomfortable with my body changing. I had spent so long learning about how to move and how my body worked and teaching other people that. And then you guys know through pregnancy, like you don't have any control. You have all these symptoms that are coming up and you don't know what's happening or kind of how to manage them a lot of the times. Like I remember teaching a yoga class. I was probably 10 weeks old or 10 weeks pregnant and couldn't even do a downward dog because it would make me so nauseous. And I was at that stage where I couldn't tell anyone I was pregnant. And so there was just a lot of, I found that stage difficult. And it carried through my postpartum. So I really entered my postpartum being like, all right, I want to get my body back. Let's do this. Like I was so excited to get back into my movement practice and just feel like myself again. And so as soon as I had my son, I kind of jumped back into it. And I did give myself some grace and tried to ease in, but also that just kind of excitement again to feel like myself again was really present. And just one more illustration of that. At the time, I was living in Hong Kong during this time, and I was very into hula hoop performing. So I would do corporate events and club events and festivals, and it was super, super fun. I loved it. And so I had jumped in again and said I would do this, my first performance back at 3 months postpartum, thinking, oh yeah, I'll be ready for it. And I was excited for it. And so at 2 months, the event coordinator asked me for some costume photos. So I had, have my big box of costumes. So I put on some different costumes and sent her the pictures. Was like, okay. And she writes back and goes, so to be frank, you look a little chubby in your photos. So, and yeah, I know. I was like, okay, yes, I'm 2 months postpartum. And, went and did a dress rehearsal with her. And she goes, so this was probably closer to the 3 month mark, like a week before the performance. And she goes, so you're looking great, just your belly that looks a little chubby. So this is what I'm dealing with, just to set the stage, right? And again, like I did it to myself. I didn't have to say yes to this performance. But this was kind of the what I was dealing with in my mind of like wanting to get my body back, wanting to get back into this industry. And so I jumped into things I shouldn't have. Kind of short story long. I jumped into things I shouldn't have. I jumped into exercises I wasn't quite ready for. I started going to my advanced yoga classes again, really before my body was ready. I didn't give myself that time and attention to intentionally heal. And because of that, I hit pretty early on in my postpartum, I started having back discomfort. So, I'd be sitting nursing or rocking baby, and I'd stand up and I felt like an old lady. I would kind of start like this and be like, like it would take me a while to kind of get myself standing up again. And again, I was like, okay, well, this is, maybe just part of postpartum and give myself time and keep working at it, whatever. And it went from that to when my son was about 6 months old and he was a big baby. My husband's first work trip, and I was carrying him. He did not sleep well, this baby, like most babies. And so I was up at night and he was waking up and waking up and waking up. And so I was picking him up and rocking him and putting him back in his crib and picking him up and putting him back. Maybe some of you can relate to this. And I hit like 2 a.m. Again, husband's not there to help. I probably would have reined him in otherwise. I hit like 2 a.m. or 3 a.m. and I was like, oh shit. And I lay there and I was like, uh-oh. And I woke up the next morning and literally couldn't move. I mean, I couldn't stand, I couldn't sit. I was like lying on the floor, like, oh my gosh, I broke myself. It was really scary. It was really, really scary. Luckily in Hong Kong, it's very common to have help, because you don't have family. So my helper came in and I'm like, Minda, like, uh-oh. So I start calling physios, chiropractors, like, I need some help here. Get over to the physio. So what had happened is I had slip discs in my L4, L5, so that's your lumbar spine. And so if you imagine your discs are like this, or your vertebrae are like this, you have spongy discs in between. And so what happens if you do these repetitive movements, so mine was this forward fold twisting movement, I had created bulging of the discs in those L4, L5 vertebrae, which had pressed against my nerve and created pain. And this was, this was a week where I had to breastfeed lying down. I couldn't breastfeed sitting up. Even getting to my physio appointments, I remember being like, I can't really sit in a taxi. I also can't really walk to the MTR, the subway system. Like it was really hard. It was really, really hard. And so started doing a deep dive of like, wow, like what is going on here? How do I fix this? And so started learning. I had already taken some prenatal and postnatal trainings and taught prenatal yoga throughout, but started just really diving into, okay, what is going on here anatomically? What do I need to do to be safe in my body again? So this was my experience, and so started to more intentionally rehab my body. So started really paying more attention instead of just jumping into the advanced yoga classes and I was doing like these boot camp classes. I was like, okay, let's rein it in here, and started paying more attention to my core, my pelvic floor, and my hips. And so really had needed that wake up call to intentionally start to rehab. And got there, it was very much my postpartum rehab after that first pregnancy was very, very rocky. I did have a couple other relapses. And they were forward fold twisting caused by that. So one was going into again, an advanced yoga class. I should have known better, but we were doing this really advanced twisting arm balance shape. And I had the muscle memory. I was like, oh yeah, I can do that. I used to be able to do it, no problem. And I had the muscle memory to do it. I could get my body in that shape, but I didn't have the core stability and the pelvic floor stability and the hip stability to support that. So again, had another relapse, another week in bed, in and out of physical therapy again. Um, and then had another one. Oh gosh, maybe they were all kind of like a few months apart. Like I'd kind of be like, okay, I'm on the right track. And then I'd do something to aggravate it again. And then I remember one more doing a hula hoop performance, doing this fancy one on my back. I would do like a plow pose with one foot and hula hoop on the foot. Anyway, very fancy, but my back said no, no, no. So I had another relapse then. So doing these things again, my body wasn't quite ready for. So I went into my second pregnancy, 2021, feeling a little nervous, but also being like, oh wow, I need to do this differently. I can't repeat that, especially with two kids. Like, I need to do this differently. And so went into my postpartum recovery very intentional, right? I wasn't doing any of the things. It helped that it was COVID, so there weren't any advanced yoga classes to go to, and there weren't any hula hoop performances happening. So I could really take that time to step back. I took more time off from work the second time around as well, which I think helped. I wasn't teaching movement for longer and really stepped back and really started to heal my pelvic floor and my core and my hips and just really slow and steady. And I didn't have any back pain at all in my second postpartum recovery. I mean, nothing, not even, I said with my son, it started with that, like, oh my gosh, I can't stand up. I didn't even have that with my daughter. So it was night and day. It was really night and day. And so that's what I've created this webinar and then the 6 week postpartum course online and love working with women because I can see the night and day of it, right? Like I can see if you want to just jump in and do other things and aren't intentionally rehabbing, the havoc it can cause. And then the other side of it, if you're slow and intentional, and I mean, I'm someone, as you can tell, who's like, I want to do all the things all the time. So it's hard for me to slow down, right? It was hard to really step back and be like, no, Emma, you need to be slow and intentional about this. But I knew that's what I needed, and it made all the difference. So that's my story with my two different recoveries. We're going to dive next into postural misalignments that happen during pregnancy and then how those play a role in our postpartum recovery. Does anyone have any questions before we jump into that? No? Okay, great. So, thinking about what happens, postural misalignments that happen when we're pregnant. So, I touched on these, Maria, in our class last week. And it's just an interesting. So, I'm a very visual person and like, I need the why, right? Like, I don't just need the exercise. I need, like, why am I doing this exercise? So, that's what I want to bring to you guys. So, I'm just going to stand up. Hopefully, I'm set up so you can see. And we'll just talk about, can you still hear me and see me okay if I'm back here? Yeah? Okay, great. So we'll talk about what happens when we're pregnant and then how this can carry over into postpartum. So when we're pregnant, we have all this extra weight on the front, of course, and that can throw our pelvis into, it's called an anterior tilt. So it's just if your pelvic bowl is here, it's tilting forward. So this is really common. And then it can also create rib flare. So we're in this place here with this anterior tilt, this rib flare. So you can probably already see in this posture with the anterior tilt and the rib flare where all that compression's going, right? Straight into your low back. The interesting thing when you're pregnant is, we'll talk a little bit more about pressure in a second, but is that you have, instead of just pushing all this pressure directly into your low back here, you have the baby pushing back from the other side, right? So it's actually more common to have back pain in postpartum than it is while you're pregnant because you have that pressure management. Yes, you're pushing out, but then the baby's pushing back against your spine to bring your spine more into neutral. So then when you're postpartum, if you're stuck here with your anterior tilt and your rib flare, but you don't have that baby pushing back against your spine, that's when you can start to have all that pressure right here, right into that low back area. And when you're pregnant, it's much more common to have round ligament pain, hip pain, pubic symphysis, right? Those are all common because of that weight that's happening. So thinking about carrying this over into postnatal, well, how do we start to correct that? The first thing, and actually I was thinking it might be a little more easier to explain pressure management with a, no, what I really wanted is, those like, my kids had them at some point. My mom always buys them, but those like squishy tubes, you know what I'm talking about? And you like squeeze it on one side and it bulges on the other side. That's what I wanted. So you can imagine Teddy is that. But if we're thinking again about that pressure pushing out towards the front here, if we try to close that pressure, we can't because of the restriction in the back. Does that make sense? So the back gets really tight and restricted, and then there's that pressure through the front and to the bottom of the pelvic floor. So until we can start to let go of this back restriction that happens, then we can't start to bring the front in. Does that make sense with my teddy? Sort of, yeah, okay. So really step one in thinking about this pressure management and bringing everything back to neutral. That's what we want, right? Is we want neutral. Neutral spine is just like a long spine. We're not creating pressure in that lumbar spine. We're not having that pressure pressing out through our abdominal wall or down through our pelvic floor. We have this neutrality through really our entire torso, our spine and our torso. So again, if we're restricted through the back because of pregnancy, we can't close the front. So we need to first think about creating that space through the back. So that's what we're going to do now. So if you're not holding baby and you have some space to do this, we're going to just practice it first. So all I want you to do, if you have the time and space, and if you need to practice this later, if you're holding baby or something like that, you can practice it later. Again, you'll have this recording and you can try it at your own time. Super simple, but you're just going to make a little ball. If you can see me, here we go. Make a little ball so you can sit on the floor, bringing your knees in, wrapping your arms around your legs, and then just easing into those back ribs. So in this space, taking a couple big breaths into your back ribs. So pretending like my hands are on your back ribs and you're breathing into them. Feeling that stretch through your back ribs and exhaling to relax. I can see some of you are doing it with me, so just doing a couple more there. Inhaling into your back ribs. Thinking about using that inhale breath as a tool to create space. And then exhale, soften, relax. And we'll just do one more there. And again, I encourage you to practice these on your own at home later. Nice big breath into the back ribs. And exhale, relax. So practicing this again is going to create that space that we need to start to close and zip up the front. So let's go and this is, I told you when I was intentionally rehabbing with my daughter, this is what I started with was breathing, and this is what I've taught, Maria's already done some of it with me, is breathing and getting that integration of pelvic floor, core, and ribs, and thinking about, again, adjusting for that pressure management. So if we have abdominal separation or rib flare postpartum, that's extra pressure through the front. If we have any pelvic floor dysfunction, so that's urinary incontinence, that's, that fear that of jumping or maybe even prolapse, that's pressure management through your pelvic floor. So we want to think about that squeeze in and up, that closure of the front and that lift up of the bottom to create, again, neutral. So we're going to practice a few rounds here. Again, you have the recording. You can practice it later if you're holding baby right now. But thinking about using our exhale to start to zip our pelvic floor in and close to the front. So just like we created space in the back, now we're going to close through the front ribs. And again, this is just like this rehab. If we're thinking about prenatal rib flare, pelvic tilt, starting to adjust for that rib flare and pelvic tilt. So when you're sitting, nice big breath in again to the back ribs, just like we practiced in our ball shape. And then exhale, we're going to close the front ribs, zip pelvic floor in and all the way up. Try to keep that and inhale into the back ribs. And we'll just do a couple more breaths. Even if you're holding baby, you can practice it. Inhaling into the back ribs, imagining that ball shape again, creating that space through the back ribs so that you can close the front ribs on your exhale. Let's do one more. Inhaling into back ribs. Exhaling to close front ribs and zip up.
By close, do you mean like flex your core, sort of?
Yeah,
Like,
there's a little bit. So again, if we think about rib flare happening, there's this deeper separation of our low ribs,
mm,
right? The space between our ribs is called the infrasternal angle, and that can increase when we're pregnant, right? It's rib flare. So if that stays with us postpartum, again, we're tight through the back ribs, open through the front ribs. That's going to be one component of back pain. So yes, you're using some abdominals, but it's really this closure of your ribs. It's not rounding, it's like this closure of your ribs and zipping in and up. Feel. Does that make sense? Does that answer your question? Kind of. And it's something to practice. It's like, I know I'm just kind of introducing you guys to it. Um, Again, it's in my 6-week online course if you're interested. It's what I start with and was what I started with my daughter. I used to go for a little walk by myself. I was very lucky to have a moment by myself, and I used to sit, and that's what I'd practice. I'd practice breathing and just getting everything close to the front again and lifting up through the pelvic floor. So it's subtle work. But it's something that you can just start to integrate. Like it doesn't have to be, oh my gosh, I have to go practice this for an hour. It's like, okay, I'm going to practice this for 5 or 10 minutes, but I'm going to try and do it every day. So it's starting to build that consistency and awareness, right? I remember when I started doing any kind of abdominal activity or strengthening work, it's you're like, where are my core muscles? Like I can't feel them. So it's starting to just build that awareness again in your muscles. And then using your hands on the front too is a great way to do that, just to palpate and be like, get them kind of waking up again. And it's totally normal. Like 100% of women who carry to full term will have abdominal separation. So it's just how quickly that's going to rebound and go back. Some of us need more of that intention, more of that guiding support of our hands, thinking about bringing into that midline. And some of us, especially depending on your natural postural alignment, for me, I tend to sit with more of an anterior tilt in my pelvis anyway, right? So like that's already something I need to work on, regardless of being pregnant or postpartum. So during pregnancy, it just exasperated that. And then during postpartum, I was left with even more anterior tilt, which again contributed to my own back pain. It's always a number of factors, right? It's never just one thing. It's always a lot of things that we have to think about working as a system. So when we're postpartum, just thinking about getting that system all working together again. Yeah. Any other questions before we keep going on that? No? How about you, Maria? No. All right. So, just going over again, thinking about what happens if we don't start to do this work, using my example at the start, right? So, just really thinking about the importance of it. And then, so we talked about getting our core, our ribs in. We talked about you want to learn a little bit more about pelvic floor, Ashley. So it's actually very interesting, but if we're left postpartum with abdominal separation, we'll have less risk of, or less likelihood of having pelvic floor dysfunction, and vice versa. So women who have pelvic floor dysfunction are less likely to have abdominal separation, lasting abdominal separation, I should say. So again, it's thinking about that pressure management, right? So if we think about the container of our torso, some people have more pressure exerting to the front, and that's that abdominal separation, and some people have more pressure exerting to the bottom, and that's going to be your pelvic floor dysfunction. And pelvic floor is something that's interesting because it's not something we're taught, right? Like, even, I mean, I did like the birthing classes. I'm sure you guys did too. There's very little attention to it. Really, I learned the most and first in my prenatal yoga teacher training that I did. This was before I was pregnant. So I went into it without awareness. Um, but yeah, it's not something that we're necessarily taught and coached unless we're going to prenatal yoga classes or doing that work that is really talked about, or like the necessity of it. But your pelvic floor muscles are just literally muscles, right, at the base of your pelvis, and they get weak when you're pregnant. So you have all that weight pressing down on your pelvic floor muscles. And then if we have a vaginal birth, we're more likely to have pelvic floor dysfunction after. If we have C-sections, we're more likely to have abdominal separation after. So, there's no win-win. And you might not have any of that pressure issue, and you might, not have either. That's great. That's certainly many cases as well. But thinking about the base of our pelvis, and it's just like anything, right? Any muscles, if we don't use them, we lose them. So they're already exposed to all of this extra stress during pregnancy and postpartum. So thinking about contracting and then the importance of relaxing. So this is something started working on, Maria, in our postpartum class. Um, but yeah, so you can imagine those muscles in the base of your pelvis, and we'll practice it now. I mean, it's called a Kegel, right? That's like kind of one of the street name for it. I always say pelvic floor exercises, but the importance of contracting and relaxing, sometimes, especially if we have, we're suffering from some incontinence or pelvic floor dysfunction, we get nervous, right? We're like, oh my gosh, I don't want to sneeze and pee in my pants, or I don't want to have to jump and have an accident. So we get really nervous, and there's this gripping that happens, which actually can be counterproductive to strengthening our pelvic floor muscles. So we really want to think about relaxing as well as contracting. So I like to think about a bicep, right? If you're already contracting your bicep and then someone tells you to contract your bicep, it's really hard. You don't see much difference in that contraction. Whereas if you totally relax your bicep, make it as jiggly as you can, and then someone tells you to contract it, okay, there you go. Now you're starting to build that strength and relax. So when we think about pelvic floor work, the same thing applies. If we're already gripping and creating tension through our pelvic floor, we can't contract, therefore we can't strengthen. So in our pelvic floor work, thinking about being able to relax fully so that we can contract fully. And if you've never done pelvic floor work, it's like you're peeing and you try to stop peeing midstream. So it's this squeeze in and up feel. So there's nothing super fancy about it. It's just that. And then there's different stages. So again, in my 6 week online course, I'll walk you through different exercises. But, again, if you're just starting to integrate this into, it doesn't have to be, you don't want to do pelvic floor exercises for an hour a day. Like that would be really hard. So thinking about integrating it more about consistency rather than, okay, I'm going to show up one time a week and do this. Like think about, okay, can I do it for 5 minutes every day or 5 days a week, right? And just trying to make that time and space. Like, okay, maybe it's like right when you wake up or right before you go to bed. And the good thing about pelvic floor exercises is you can kind of do them anywhere. Like you can do it in the car when you're driving. Just one more tip on that that's really helpful is, so again, thinking about pregnancy and postural misalignments that happen when we're pregnant is our, think about like the classic pregnant duck shape, right? Our thighs roll out a little bit. And when our thighs roll out, that's because of this baby here in the front. But when our thighs roll out, that can often push us more into that anterior tilt. So again, if we're thinking about corrective exercises to correct for those postural misalignments that happen during prenatal, we want to think about doing the opposite. So that roll in of our thighs. And this is really subtle. I feel like it's hard to get people to really understand properly, but when we think about our thighs rolling in and squeezing in, then that broadens the base of our pelvis. And you might be able to feel this when you practice it, but if you can't, just even knowing it can help. So again, if we're stuck in this anterior tilt and this external rotation in our thighs, then we're narrowing the base of our pelvis, which can make it hard to lift our pelvic floor muscles. So when we do the opposite, internally rotate, make sure we're in neutral spine, so not arching through our low back, then it's going to make it easier to lift our pelvic floor muscles. So one of my favorite ways, and again, Maria knows this one from class, I have you guys do it so much, is squeezing a block. So if you're at home, Ashley, and you're practicing this, just squeezing a block between your knees. You can do it here, you can do it sitting in a chair. It doesn't have to be a block, it can be a rolled up towel, it can be a Pilates ball. But when you squeeze it, you might even be able to feel your thigh bones moving to the outer edges of your hip sockets and that extra space so that you can lift your pelvic floor. So again, just like a super great tool to have in your back pocket to start, especially if you're struggling, like, oh my gosh, I can't. And I have this isn't uncommon. I have women quite often who are like, I can't feel my pelvic floor muscles. I don't know how to engage them. So this is just another tool. If that's you, another tool to have in your back pocket. Okay, I'm going to try squeezing a block and then try different positions. So try it sitting, try it on all fours, like in a tabletop. So just different positions, and you might find some of them are more like kind of click better than others. So that's that controlling of the pressure from the bottom, controlling of the pressure from the front, and then yeah, building consistency with those. So I mean, I think I showed up and I would do, yeah, like 10 minutes 5 days a week, right? So it's just starting to get consistent with that healing. And it takes time. That was another thing going in with my son. I was like, all right, 9 months in, 9 months out, that's all it takes. I'm gonna, and it's like, no, 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 no. Having had my two babies now, and my youngest just turned 5, and it really took like I remember hitting they're a little over 3 years apart, and I remember hitting the 2 year mark with my son and being like, okay, I feel like myself again, right? And of course I had ups and downs. And I remember and then getting to 2.5 years postpartum with my son and being like, oh no, no, now I feel good, right? So it was like you keep feeling better and better. Of course, then I got pregnant with my daughter when I was 2.5 months postpartum with my son. And then same thing with my daughter. Like it was the 2 year mark, I kind of started feeling like, oh, all right, everything's clicking and working like it should be again. And then it was really the 3 year mark where I was like, oh, I feel great in my body. So it takes time, right? And that was really the biggest lesson I learned is you can't rush it. Like there's a saying, right? Like once postpartum, always postpartum. Like we're always our bodies, they do change, and respecting that difference and like acknowledging our strength, like, we all know that because we had babies, like it's amazing what our bodies can do. It's amazing what they can do. So really tapping into that and just being like working with our bodies instead of against them, I think is so important in this postpartum journey. So that's kind of all I have to share. So I hope that makes sense and some of it clicks. And it just helps. Again, like I feel like the knowledge component is so important. And it's something that even when I'm teaching a class, like I can only kind of incorporate little bits because, we're there to move. And so I try to integrate it. But I was excited to really dive a little deeper into, the anatomy of what happens, the why behind uh, the work that we need to do, not just doing the work, but like why it's important. So, yeah, I hope some of that resonated. Do you guys have any questions about any of that?
Thank you. That was helpful.
Good, good. Yeah, and if you have any questions that are like not totally exactly on the topic of the discovered, I'm also happy to share.
Question, Emma. I have more of like a sciatic back pain
Hmm.
that I think is exacerbated by the bending and twisting and all the things.
Hmm.
Would you recommend those exercises or would you recommend anything different for that?
Yeah, that's a great question. So you have sciatica running down your leg on one side or
Yes.
both? One side. Yeah.
One side.
Yeah, so that's a great question, Maria. And we didn't talk as much about hips. So, but our hips again are really bear the brunt of our pregnancy, right? So, and one other thing we didn't talk about is the role of relaxin in our bodies. So, when we're pregnant, we have something called relaxin. Maybe you've heard of it, but it's just a hormone that you secrete during pregnancy and postpartum, and all through. If you're breastfeeding, then you're going to continue to excrete it. And so, all relaxin is, it's a hormone that helps you loosen your ligaments, which you can see the value of, right? When we're delivering baby, we need our ligaments are the connective tissue between our muscles and our bone. And so you can see the relevance of that, right? Our pelvis needs to shift a little to get the baby out. But this shifting of our pelvis can create a whole slew of problems in itself. So maybe some of you have heard of or experienced pubic symphysis. That's right, the pelvic bowl kind of narrowing in the bottom and those bones bumping into each other. That's that sharp pain. Sometimes it's referred to as lightning crotch. It's such a not a nice casual term, but you might have heard that. Um, yes. So thinking about how to create stability. So we talked a lot about pressure management, but creating stability around our pelvic bowl too. So really thinking about the muscles around our pelvis and how we can start to strengthen those is going to be really beneficial. So thinking about sciatica specifically, your sciatic nerve actually starts in your low back. That's where it originates, is in your low back. I think it is right around L4, L5. And it goes down through your glute and then down your thigh. And so the glute muscle that's really responsible for sciatica is your piriformis. And it's just an interesting muscle because it attaches at the top of your thigh bone, runs through the bowl of your pelvis, and then attaches it at your low back. So what happens with sciatica is your sciatic nerve can either run over your piriformis muscle, under your piriformis muscle, or through it. And there's no way to tell. So, unless you do an autopsy, there's no way to tell. And so people, like if your sciatic nerve runs through your piriformis muscle, you're more susceptible to sciatic pain. Under it, a little less. Over it, you're usually fine. So it's just interesting to know that like there's a genetic and anatomical predisposition to sciatic pain. That doesn't mean you can't do anything about it. So just knowing that's usually the origin of the pinch that's happening is that piriformis, which is one of your glute muscles, pinching on that sciatic nerve. So the best things for that are going to be strengthening and lengthening, right? Anytime we think about tight muscles, they're often weak muscles. So sometimes we just think, oh, stretch, stretch, stretch. That might create some temporary relief, but probably not going to be as much lasting relief. So you want to think about strengthening and lengthening glute muscles. So best exercises for this, bridges are a great one for strengthening your glutes. Lunges, great one. Anytime you're doing a lunge, thinking about tilting your body weight forward into that front leg, that's going to does that make sense? So if I'm doing a lunge here, if I'm tilting back, that's going to put more effort into my quadricep. If I tilt forward, that's going to put more effort into my glute. in the front leg. And you'll feel it. If you sit here and do this, you'll be like, oh, yes, that makes sense. So doing lunges, but with more weight in that front leg, that's a great one to strengthen. And then thinking about lengthening. So lengthening like a figure 4 stretch. Do you know this one, Maria? So it's just anything where you're stretching this glute. So putting your ankle over your knee and then pulling in. Yeah, you've probably done this one.
Yes, we
Or
did that
pigeon
last week.
pose in yoga, pigeon pose. So those are great ones for lengthening. But again, thinking about doing some strengthening in addition to lengthening and having that focus be on your glutes is going to be beneficial for getting you out of that sciatic pain. I hope that helps.
That helps a lot. Thank you.
Yeah, good, good. Any other questions, Ashley or Maria? No. So if you're interested, Ashley, if you'd like to join too. So Maria comes to my it's just at Prescott, but it's the postnatal class with babies. So it's most of the babies are your Juno, right? Juno's age.
Oh, Jada.
Jaina. Yeah, most of them are right around Jaina's age. So,
Oh, cool.
and we'll start practicing some of the stuff that we talked about. So, pelvic floor for sure, core. We just did hips last week. One other thing I didn't talk about at all yet, but is the relationship too of shoulders. So we're going to work on
Oh,
that
yeah.
next
That's
on
a
Friday,
problem.
Maria. But thinking about we're always holding, bouncing babies. So again, we can get
Yeah.
very stuck here. So which can contribute again to back pain. So
Yeah.
thinking about how we can create strength and resilience and opening here in our shoulders.
What's the
Um,
Prescott program called?
Oh yeah, so I can send it to you if you want, but it is called Moms Who Move,
Okay.
postpartum. I think it's called postpartum rehabilitation with baby. So we bring the
Okay.
babies and we do
Yeah.
incorporate them in some of the exercises, which is nice.
Okay.
Sometimes they do better than others, but usually they
Yeah.
do great. Usually they like the environment.
And
And
when they
then,
don't do well, we're in it
yeah, as well,
together.
I'll send you information
Sounds good.
so in my 6 week online course, I have to say, I was so excited building it because it's exactly what I needed the first time and really the approach I took the second time to postpartum healing. And it's exactly what we've been walking through. So, in the 6 week course, I do 5 classes a week. It's self-paced, so you don't have to do 5 classes a week. The classes are designed to be short and sweet, so they're 20 to 30-minute classes designed to be able to fit in and build consistency into your routine. So instead of just, that once a week, you're really starting to do it, 4 or 5 times a week, but shorter durations. And then out of those 5 classes in a week, I target a different area each time. So we spend week the first day always focusing on pelvic floor, the second focusing on core, the third focusing on hips. So each and we talked about glutes today, Maria, but in the course, I'll walk you through the different muscle groups in your hips, how those are affected during prenatal, and then how we can start to, again, just correct for those postural misalignments in prenatal and build more strength, stability, and endurance through our pelvis. So that's the third one. 4 is shoulders, like I was just saying. So building that strength through the back of our body and opening through the front of our body to start to counter all of the baby holding that's happening. And then the last class of the week is restorative yoga. So just designed to be super relaxing, more for your mind, giving yourself that peace and quiet and space, which I know is so hard to get with babies. So that's the format of the online course. So it really takes a lot of what we've just been talking about, a lot of the knowledge that we've been talking about today, and then applies it all. So that's part of my, wanting to create this webinar is to be able to share that with you guys. So I'll send it to you if you're interested, or if you have any questions about it now as well, certainly let me know. And then, yeah. Well, yeah. Do you have any other questions about any of that?
No, thank you.
Okay, great. Yeah, well, I hope this was helpful. And thank you so much for joining my first webinar.
Yeah, good job.
Yeah,
It was great.
good,
Great.
good, good, good. Yeah, I
Thank
hope
you,
it was
Emma.
helpful. I mean, I feel like knowledge is power, and I feel like it's like often the missing link between, right? Like when you kind of know what's happening, then you can start to take control of your situation and start to really, heal yourself from the inside out. So,
Yeah.
yeah, I
I think
hope
it's
that was
crazy
helpful.
this information doesn't come from your OB. Don't you think?
Say again.
I think it's crazy that it's not like a standard postnatal educate, like postpartum
Yeah,
education from your
I
OB,
know. I totally
right? Like,
agree. Well,
there's not
there's
a
a
person
lot of
who
like the
wouldn't
deeper
benefit
I
from it.
dive into the postpartum world, I feel like there's more and more awareness around the fact that there's a missing link. And then there's
Yeah.
more and more providers like myself who are trying to fill it. But it
Yeah.
is something you have to search out. And a lot of
Hmm.
people don't unless they're having a problem already. And I think
Right,
that's one of the
exactly.
things that I learned because I had a problem with my first one and had to search out help. And then with my second, I was like, oh, you don't have to search out help if you learn it the first, if you learn it and start
Yeah.
practicing it.
Yeah.
So, but yeah, there's totally a missing link. And there's some really interesting explanations around it. And a lot of it is like this, if you look at the history of postpartum care, there was a lot more care for moms, right? When we lived in the midwife era, and it was like, yes, we're having the baby, but we take care of the moms, and there's like all this support built around it. And then now once we started really hospitalizing births, those got shorter and shorter. Like it used to be, okay, you're in the hospital for a week, and then now it's
Mhm.
like in and out as fast as you can. And a lot of us don't even have the family support around us. And then anyway, you guys know I'm preaching to the choir, but it's interesting to look at the why again, the why there isn't the support. And unfortunately, it's a lot of it is financial too, money first, right? You're getting the
Yeah.
babies in and out, and then all the focus is on taking care of the babies, making sure they're healthy. There's really not the attention to the moms that there should be. And then you go to your 6-week checkup, and they're like, "Oh, great, you can exercise, whatever that means." You know,
Yeah, true.
it's like, there's
You're
such a
cleared.
huge variance of exercise. Like you can, you don't want to go start with a marathon, do you? So.
Right.
Yeah, but there's becoming, and again, like I'm kind of trying to get to know the local community more, and there are some lovely women out there doing doula work and birth classes and, um, you know, uh, PT specifically for pelvic floor. So,
Mhm.
but unfortunately, yes, that thing you really have to do, go out and seek at the moment. Yeah,
Yeah.
I mean, I'd love to see it more in the built into the system, but that might be
Doesn't
wishful
currently
thinking right
exist.
now.
Yeah.
Let's see.
Yeah.
Yeah. How did you find it with your first and then your second, just with, did you just that was it just did you feel kind of not taken care of just with that 6 week
I
checkup and
I've, like after my first, I had no idea that there was a pelvic floor
yeah,
rehab or need for it or
exactly.
anything. There was
Yeah.
no mention of it from
Nope.
my doctors or the
Yep.
hospital or discharge instructions or anything, which I find
Mhm.
crazy. And
Yep.
then I started like the peeing when you sneeze thing.
Mhm.
I had trouble with that, and so I
Yep.
went to a pelvic floor PT,
Mhm.
but it's hard to be consistent with the exercises. So
Mhm.
I'm just much more aware of it with the second pregnancy and like trying to be proactive and sort of
Yes.
go slowly and
Mhm.
try to heal in the immediate postpartum period.
Yeah, exactly. Exactly. Well, it sounds like you're on the right track for sure.
Yeah,
And I think knowing that it's normal too, like the
right.
thing that I find is knowing that it's common, knowing it's normal and common, but also fixable, right?
Exactly.
It's
Yeah.
really finding that bridge.
Yep.
Yes, yes. Well, I'll send you some more resources and
Okay, thank you.
again, like I built this online course with that exact intention, like how can
Yeah.
we help moms build consistency? Because
And
that
is
is
the
the key and it can be really hard to do on your own.
is
Yeah.
the in-person course like similar content on the online course? Just you do the practices together or
Yeah, so
Yeah.
the in-person one, we take the babies with us. So again,
Yeah.
trying to make it more accessible for moms not having
Yeah.
childcare and etc. It's 45-minute class, and we do cover a lot of similar content for sure. Yeah, we do. So especially this course, I've started breaking it down. I think there's some limitations just with the babies being there. Sometimes they're
Yeah.
great and they just lie there and we can do the whole thing. And then
Right.
sometimes, they need breastfeeding and bouncing. And
Yeah.
so there's more interruptions for the moms. But I try to help out when I can too. If there's, a baby fussing that is happy for me to
Yeah.
bounce them, I'm happy to bounce them.
Yeah.
And then the online one, we dive a little deeper. It's a bit more specific. I think because I've designed it instead of the one class a week, I've designed it to be 5 classes a week. Again, it's self-paced. You have access to it forever. Um,
Okay.
yeah, but so I dive a little bit deeper. Like, I'm just thinking about, again, the hip section, for example. Like I do one class on the glutes, one on the psoas muscle, which again is just an interesting one that gets very stretched out during pregnancy and can be affected and plays a huge role in pelvic stability. So there's one class on that. There's one class on, external rotation versus internal rotation. So I dive a little bit deeper into the specifics.
Okay.
As we go, it is kind of builds on itself as well. So it becomes a little more challenging as we go throughout the 6 weeks. And then it's lifetime access, so you can take it at your own pace. Yeah, yes, but I've dived a little bit deeper into each of the classes. And then also I like send a lot of reminders in the course of like, if you feel like you really need this class, mark it, save it, do it again. So I think
Mm.
that's the beauty of it is that, for like Maria, if she was doing um the class for glutes and piriformis and she was like, "Oh my gosh, this is what I need for my sciatica." She could save it and then repeat it,
Right.
right?
Right.
And like do it every week instead of just the once. So, yeah,
Makes
so it's a
sense.
little bit more, you have a little bit more personal direction, I guess, and more content. I mean, 6 classes, 5 classes a week, it's over 30 classes, so it's a lot
Oh yeah, it's a lot.
of classes. Yeah, I
Okay,
mean, I had
awesome.
so much, it's interesting because I had so much fun filming it. Like, I loved making it, and then now I'm like, all right, now how do I deliver this?
Yeah, right. There's people that need this content.
There's people that need this. I made
Yeah.
it for you.
Yeah.
So anyway, this is my first attempt is building the webinar and just starting to create more knowledge around it. And yeah, so I'll send you the details and you can check it out and see if you think of it
Okay.
or not. I'll send you the ones
Awesome.
for the in-person class too. It's
Okay.
through Prescott, they do course packages. So we've already started this course, but if you reach out and you want to prorate it and just jump in, you're always welcome. There's space in the
Okay.
class. I think we've got 8 right now, so it's a nice group.
Okay, cool.
Yeah,
Thank you.
definitely. Yeah. Any other questions about anything? No?
Nope.
Good. How about you, Maria?
Just one question. I was thinking about either taking the class again, like for your next session. Does that make sense, or does doing your webinar make more sense for like continued practice?
Honestly, if you can do both, I mean, of course, I think the in-person one's so nice because you get to, be in the room with the other moms
Yeah.
and the babies. And so I just love that. Like, creating community around it. I know for
Hmm.
me, that was something that was like so valuable having babies and being able to connect with
Yeah.
other moms. So I love that side of it. I would say the online can be a really nice supplement. Like,
Hmm.
because again, doing it once a week, like, I would love you to be building more consistency and doing it like 3 to 5 times a week, so that you can really start
Yeah.
to see the results and feel your body healing. And so yeah, I mean, honestly, I think that if you do the in-person and then supplement, also I find the window with the in-person's really short. Like there's a huge turnover because babies get bigger. Once they're kind of post-crawling, it's harder for moms
Okay.
to navigate. And then also, I know a lot of moms are going back to work. So it makes it harder to go to that time. So see what works for your schedule and what you have available. But yeah, I mean, and I have had students in the um not in your class, but the class previous to you who did do the online course as well. So yeah, they were kind of using it as their in-home and then in person. Does that help?
That does. I wasn't sure if I like took another session, if it was like designed, if you had designed it in a way that like you did this the 6 weeks, right? And then something different. But I would love to come back for the next session.
Yeah, yeah, I got you. It kind of depends on who shows up, to be honest, because like I said, there's a big turnover. There's just like that kind of short baby window where it's easy to bring babies with you. And then I do offer a core strength and conditioning class on Thursday evenings, which I know some moms have expressed interest, especially those like going back to work, thinking about, okay, how can they continue their in-person classes. I mean, it's a great one for continuing to build core strength. I think that definitely giving yourself that time and intention before jumping into a more rigorous group class is beneficial. Um, but yeah, so it kind of depends on where you're at. But yeah, and because I have a big turnover, I'll do a lot of the same topics, but you'll find that as you build strength and as you've practiced some of similar exercises or some of the similar practices that you'll feel the exercise differently. Does that make sense? Yeah. So I know like for me the first time I started I was like I was saying like what core works?" And then as you start to build strength, okay. And I'll give some room for progressions as well, especially if there's moms who have been taking the class for a while. So making sure that, everyone's within their limit, but they're still feeling like they're challenging themselves. Does that make sense?
Makes perfect sense.
Yeah.
Yes.
Yeah.
Thank you.
Good. Great. Well, any other questions before we head out? Well, thank you again so much for joining. I'm so happy that we were able to connect online and yeah, thanks for coming and bringing babies.
Thank
Yeah.
you.
Yeah, definitely. My pleasure. And I'll send out this recording again too. So, and also, spread the word if you have any other moms who you're welcome to share the recording with them if you think that it's helpful or send any of the online resources or in-person resources with them. Good.
Awesome.
Well,
Thanks.
yeah, enjoy rest of your Thursday.
Bye.
Bye.